It's now my pleasure, as an old guy, to introduce a young guy who I think is doing an extraordinary job of leading this Commonwealth. And that's Charlie Baker, our governor. He's been a friend for a very long time. Been an admirer for almost since the day I met him. I've watched him grow through a number of different roles in his very successful life. I watched what he did with his turnaround in healthcare insurance. I watched with Habit Pilgrim. I watched him on the private sector, and now I've had a privilege, along with all the rest of us, to watch him lead this Commonwealth with a very steady hand. And one of the things I most admire about this governor is that he truly does care about all of us, not just the ones who are successful, but all of us. And that's why he introduced the legislation he did. That's why he worked with the legislature to get it approved. So you're one of my heroes, Governor. And I'd like now to ask you to come and say a few words. Thank you.
Well, I want to thank Jack for introducing me, because he is one of the few people who could call me one of the young guys, I guess. It's all relative, right, Jack? Well, first of all, you know, I say this a lot. I didn't run for governor to work on the opioid issue. The opioid issue found me when I was a candidate. And it was one of these things where people would come up to me after I got into the race, and I'd have town halls, and people would come up to me and they'd say, you're a healthcare guy, right? And I'd say, yeah. And they'd say, well, I got this friend. And then they'd tell me some story about their friend. And this happened a lot. So I eventually got to the point where I just started incorporating commentary about what I was hearing about this issue into my remarks, hoping that if I gave people permission in my remarks, as I talked about what I was hearing and seeing as I was campaigning, that would give them permission to speak more forthrightly about the issue. And truthfully, it was sort of an incremental process, because at first nobody still wouldn't bring it up as part of the public discussion, but they'd come up to me afterwards. Instead of saying I have a friend, they'd say I have a son or a daughter or a brother or a sister, or a coworker or a mother or a father. And all the stories eventually involve the same phrase, which is, it's been hell. And everybody's definition of hell was a little different, but believe me, they were hell. Rena, congratulations on your trip back from there, and God bless and Godspeed to you. But I was talking to my wife about this one day, and I was saying, geez, everywhere I go, I hear this, everywhere. And she just sat there for a few minutes, and she said, you know, when Charlie got hurt playing football, my God, I bet he took hundreds of opioids. I wonder why this didn't stick with him. Now, I'm a healthcare guy, and I was busy trying to help people deal with this issue in my own way when I was out campaigning and trying to connect them with resources and services, without ever realizing what a bullet my own family had dodged in the midst of all this. And I can't tell you how many of these stories started with somebody who got hurt or got injured or had surgery or whatever it was. And, you know, along the way I figured out that we represent 5% of the world's population, but we consume 80% of the world's opioids. And that 4 out of 5 heroin users started on pain medication. And that if you track the lines between 2000 and 2015 and you run opioid prescriptions, overdoses, and deaths, they track almost identically to each other. The only thing that's really changed in the last couple of years, sadly, is the arrival of fentanyl, which is sort of the Godzilla of opioids, and really wasn't even a crime on the books specifically here in Massachusetts until a couple years ago when the Attorney General raised it as an issue, and we worked with her and with the legislature to get it passed into law. And the more people I talked to, I learned a few really important things. The first was there's a tremendous amount of isolation and shame that comes with this. And that isolation and shame doesn't just involve the person who's dealing with addiction, it also involves their family. There's a moment in one of the documentaries about this issue where a mom who's got a child who's dealing with this says, you know, if my kid had cancer, I'd be telling the neighbors about it and they'd be showing up with casseroles. But because my kid has an addiction, which is in many cases has a mortality rate that's as high as many forms of cancer, I don't feel like I can talk to my friends, and my friends probably don't want to talk to me. So creating a climate for treatment is part of this issue as well. Even if you know what to do, getting people comfortable with the idea that it's okay to reach out and engage and to stay engaged and to climb over that's a big deal. Joanne Peterson, where are you? Learn to Cope, which is a peer support group for parents that are dealing with this issue or family members. Joanne started this in part because of the lack of places for people to go to talk to other people who are dealing with similar circumstances and situations in their own life. And Learn to Cope, with the help of a lot of people, including the Commonwealth, is now available pretty much across the Commonwealth. But I've been to a bunch of their meetings, and I'll tell you something, I will never forget. I was at a meeting in Cambridge, and people are going around the room and they're just talking about what they're dealing with. And one of the guys there said, I'm from Cambridge, but the first time I went to one of these meetings, I went to a meeting in Salem, because I didn't want to go to a meeting in Cambridge because I was afraid I'd see somebody I knew. So he goes to the meeting in Salem and he runs into 3 people he knows from Cambridge. The capacity for people to simply engage openly and honestly and with empathy and commitment on this issue is a huge part of getting somewhere. Now, we're doing a bunch of things here at the state level, and it's been completely bipartisan. Every piece of legislation that's passed on this is passed unanimously because everybody gets it. We've increased our spending on treatment and recovery by 50% over the past couple of years. I think we're the only state in the country where you can't graduate from dental school, medical school, or nursing school without passing a course in opioid therapy and pain management. It's always blown me away. But with all this going on around us, very small numbers of people who graduated from any of those schools really ever knew very much about what they were dealing with. We're one of the few states where, as part of your licensure process and continuing education, you have to take courses in opioid therapy and pain management. And we're one of the few states that's created a very interactive and compelling tool for prescribers to use to manage and measure their own prescribing patterns relative to others. Now, we're here today to talk mostly about treatment and recovery. But there's also a prevention and education element to this that you can't miss. Because as I said before, if you look at the prescribing lines, the overdose lines, and the death lines, it's like 3 trips to hell. And all those families that I talked to and met, and all those people who are dealing with addiction during the campaign and since. And we talk a lot about the economic consequences of this. I've never seen anything in my life that can destroy a family or a community like this. It's so much bigger than economics. And I'm thrilled that a whole bunch of other states have sort of adopted the Massachusetts blueprint as their own. But as I said on the day we signed the legislation, there is so much negative momentum in this. That just bending the trend and breaking the back of this horrible epidemic is going to require everybody's best efforts on a sustained basis over a long period of time. In some respects, it's a lot like what Rena went through. You know, if we aren't willing to commit to this in a serious way over a fairly long period of time, this is a relentless foe. Relentless. If we aren't willing to be relentless in response to what we're up against, our chances for success will be significantly diminished. Now, the good news on this is I do believe we can and will be relentless. That waiver we got, which was, took thousands of hours and, my God, more work than you could ever possibly imagine, 2 years of Mary Lou's life and half her staff's, gives us the ability to dramatically expand and build on treatment protocols for addiction and behavioral health issues for the 1.9 million people in Massachusetts who are covered by Mass Health. And it looks like, for the time being, we're going to be able to continue to implement it, which is a good thing. And we're going to continue to chase a whole series of initiatives on our own to try to do what we can around prevention, education, and intervention and treatment and recovery. But as Jack and others said, this is not an issue that any one group on its own is going to be able to put to bed. We need the best minds, and the biggest brains, and the most zealous advocates here in the Commonwealth engaged together on this with persistence and determination and relentlessness if we're going to be successful. And your presence here today, your presence here speaks to the fact that you get what we're up against. And you understand the human tragedy that's associated with this terrible epidemic. And it is an epidemic. I don't care where you put 20 people in a room, I promise you, one of those 20 people, probably more, has direct experience with this. This idea that somehow this is happening someplace other than where you live or where you work, do not kid yourself. You can't lose 6 people a day and have this be some isolated thing that's going on in some place that has nothing to do with us. It's all of us. And on behalf of the Commonwealth, I can tell you this. We are going to continue to work as hard as we possibly can to build on the work of the past couple of years and to continue to fight this fight. But having folks like you and organizations like Boston Medical and organizations like Partners and all the big brains that come with those organizations and the stiff spines engaged in this is an incredibly important statement as we begin, yes, the long walk to take this monster down. Thank you very much.
I told you he cared. Thank you, Governor. Thanks very much. By the way, I'd be remiss if I didn't commend the the Taj Hotel for doing such an extraordinary job in the hospitality today and the breakfast they put together. Now, if they could just work on the noise from the steam pipes, I think we'd really, this side of the room would be particularly delighted. Our next speaker is also a real winner. She's the Attorney General of the Commonwealth of Massachusetts, and she knows all about winning. She was a leader on the basketball court when she was 6'5½", playing for Harvard. She was a leader in law. She studied under a wonderful Attorney General and became, and her first attempt to be elected to public office was elected as our Attorney General, and she's done an extraordinary job in a lot of areas, not the least of which has been this area, opioid addiction. And she created a task force. This is just one example that went right after first identifying and then addressing docs who were writing unusually and maybe suspiciously large numbers of prescriptions. And that therein, as you've heard a couple of times this morning, is a real part of the problem. So it's my pleasure to introduce our Attorney General, who I think is not only an extraordinary Attorney General, but will continue to be an extraordinary general for the next 4 years, in my hope. Maura Healey.
Thanks, Jack. I think you screwed up. I wish I was 6'5". I would have had a lot more points. Jack, thank you so much, and I am so heartened to be here this morning and to be among all of you. And I say that because I have seen and witnessed and worked on this issue for going on now 3.5, 4 years, because I too share the governor's reflection in that when I started running for office, there wasn't a boardroom or an event or a fundraiser I left where somebody didn't come up to me afterwards and talk to me about their sister, their brother, their kid, their mother, their father. And they were asking for help. And we saw this story sort of emerge, not just here, but nationally, and really take over the story for so much of the last few years, as it rightly should. But this is a story that is so long in the making. And I just want to speak for a moment to what I see as tremendous opportunity right now to deal with very real issues of substance use and mental health. And these two things, I'm looking at, I'm just a JD, so what do I know? I'm looking at a lot of health professionals who know that these things go hand in hand, and that for far too long in our society, we've decided to not deal with those things as directly as we should. Because I know if I asked for a show of hands right now, everybody's hand would go up to signify that someone in their family is affected by these issues. This is the opportunity for us in Massachusetts to do what we've long needed to do, and as Massachusetts always does, we will lead. We have an opportunity with the best brains, the best talent, the most talented healthcare providers, the most committed hospitals and research institutions, and the most wonderfully philanthropic, public-minded, civically engaged business environment to make a meaningful contribution that will forever alter not just the lives of families here in this state, but I truly believe families all across this country. And when I sit with my colleagues, attorneys general all across this country, this is their top issue. Every day in their state, people are dying young and old, of all races, of all socioeconomic backgrounds. Families are devastated and ripped apart. Communities devastated. Public safety undermined. We know what's happened now in the wake of this opioid crisis with the onslaught of fentanyl in particular, not just heroin, but fentanyl into our communities. There is much work to do, but I know that through an effort like RIZE Massachusetts, this is going to be the way out. I give so much credit to folks like Raina. Anybody who knows anybody who has lived with recovery, struggled with addiction, I can't begin to appreciate fully what that takes in terms of courage, discipline, perseverance. It's truly, truly incredible. And you find yourself on that path, on your road, you can do anything. You can make anything possible. But one thing that does make it more possible for so many is the participation of community. Community is represented by the likes of the interests in this room. Now is your time. Each and every one of you brings something to this. It's not just an important financial commitment and component, which is indeed important. We know that commitment is important. But it's also the expression and the statement of we value people, we value families, and we have the wherewithal to collectively take this on. You know, one of the great things about being able to serve as an elected official in Massachusetts is to wake up every day knowing, yes, we have a lot on our plate, but across this state we have an incredible, incredible offering of human capital, of intellectual capital, of a business philosophy and philanthropic bent that enable our state to do great things. It's no wonder that Massachusetts is the #1 state in the country, the place where people want to live. We have that capacity, we have that ability. But we also know that this morning, if you walked a mere 100 yards across this beautiful public garden, you would see people all along the sidewalk who sadly are struggling. You don't have to go over to BMC either. You don't have to go down the street to MGH. I see it every day as I come into work, and I know you do as well. It is that pervasive. But this is the opportunity now to reach out and make that difference. We've worked hard here the last 3 years. We've taken action to cut down on illegal prescribing practices, to change the culture around prescribing practices, working directly with doctors and others in the field. That's good. We've taken action to change dispensing practices, better controls in how we administer and give out opioids. That's good. Yes, we recognize that fentanyl was a problem, and we made that a crime here, and my office has already had multiple prosecutions against those who would traffic in these lethal and terribly, terribly tragic and dangerous drugs into our community. And at the beginning of all this, when we saw the price of Narcan going up, recognizing that it was a life-saving measure, we worked hard to work with the manufacturer to reduce the price of Narcan, make it available to all first responders. This is all good and necessary work. But I see through the lives and the stories told to me by people who will walk out of treatment facilities today, there is terrible concern about housing, the security of housing, the security of employment, ongoing needs for trauma counseling, for mental health care. All of this work is so necessary and so important to sustained recovery. And that's what we're about. We are about results here in Massachusetts. We're about real results, and we're about lasting results. But we know the kind of foundation that's necessary for that to occur. And so I think that through this effort, RIZE Massachusetts, everyone coming together to contribute, to bring to the table what they best can bring to the table, and it takes different forms for different organizations and entities as represented in this room. This is how we're going to make a difference. And when I think about those families who I know I will encounter somewhere along the journey today, I think about what lies ahead in terms of hope for them, betterment for their loved ones, betterment for their families. I also think about today's 2nd, 3rd, and 4th graders. I was late, I got stuck behind a bus somewhere. Thank you, Mayor, it's good, I love the city. It's not a comment on that. And it's great to see these little bright faces in the bus heading off to school around the city. But I'm thinking about them right now, and I'm thinking about the kind of world that they are going to grow into in the next few years, what they're going to encounter. You know, we recently had a wonderful agreement that we worked out with CVS and Walgreens around dispensing practices, and they made a significant contribution that we're putting directly towards education. But I had a mere $700,000 to offer for that cause. When we put out the application to schools looking for that kind of prevention education and modeling, we got over $4 million worth of requests. So there is need, folks, out there, and there is need that will go, that really speaks to the issue of the importance of education and prevention. And that's also where RIZE Massachusetts comes in. I thank you all for the work that you do day in and day out in caring for patients and taking care of our families and taking care of our communities. I thank those particularly family members here and others who have worked directly and experienced directly addiction, and you really are amazing people to me for your strength and your fortitude. And I am just so heartened that as Attorney General, my office will continue to be part of working collaboratively to make a difference. Not only, remember folks, this isn't only about Massachusetts, this is about as things go nationally. And I also will commit to you this, whatever they want to do down in Washington, they better not ever come at us again with a bill that's going to strip funding for much needed mental health and drug substance services again. Okay? Thank you very much, Jack.
General, thanks for your strength, and thanks for your fortitude, and thanks for your leadership. Thank you very much. You know, sitting here listening to the governor and the attorney general, one wonders, why can't we have this as a nation, you know? So I'm here to announce that the governor... Well, we'll hold that. We want to focus on this as well. So we have a third speaker, the mayor of the city of Boston, Mayor Martin Walsh. We're talking this morning about addiction, and we're talking about recovery, and we're talking about leadership. And in this case, this gentleman knows about all three. And he's made it very public because he wants to be a good example that he is in recovery. And I have come to know him over the last 3 years of his 24-year term. And I've come to really admire him. He's a natural-born leader. He's a good man. He leads by example. And just to give you a case in point, when the governor introduced his legislation, the mayor was right there. He supported it. He testified on behalf of it. He felt strongly for it. And he worked within the legislature, his old home, to help the governor pass the legislation. And so that was a team effort, and it was a very successful one. Just in the city of Boston, he's introduced a hotline for help. It's 311, if I'm not mistaken. And so it's now my pleasure to introduce my friend, the mayor of the city of Boston, Marty Walsh.
Thank you, Jack. First of all, I want to thank Jack for everything that he does in this city and this state. He's a guy that I think we all call when we have a tough question, tough answer we don't know, we call Jack, and he finds the answer out. And I want to thank you. I want to thank all the leadership of RIZE. Thank you very much for what you do, every single one of you, and being here this morning. This is such an important issue. It's been said so many times today that people in every neighborhood are struggling today, are working to get clean. And there are people in this room. When the Attorney General talked about outside 100 yards from here, there's probably somebody in this room that's struggling with alcohol or drug addiction. If not, there's probably somebody in this room that has a family member struggling with alcohol or drug addiction, having breakfast at the Taj on Tuesday morning. This is not an illness or a disease that just hits homeless people. When I went to treatment, the first question was, describe what an alcoholic is, and what do you think it is? And my response, and a lot of people's response is, well, it's a homeless person. Of course that's an alcoholic. And back then it was, you know, it's anybody, it's your neighbor, it's your friend, it's your colleague. And that's what it is today. Stigma is a huge obstacle to overcome. The stigma of addiction is hard, whether it's a kid or a wife or a husband or yourself. People can't kind of get over that. They don't want to talk about it, and that, you know, it's hard. We're focused on areas in the city of Boston like Melina Katz Boulevard and Mass Ave. And that was deemed methadone mile by whoever. It's not methadone mile, it's Recovery Road, because if you look there, it's recovery programs that are actually there. And the people that are on that street are trying to, most of them are coming from or going to a treatment facility. And it's something that's important for us to understand that, again, it's about stigma. And when you hear the stigma of methadone mile, well, that's not a positive stigma, which will prevent people from wanting to go to treatment. Which will prevent people, because most people that go into the methadone clinics down there, you don't even see them. You don't know them. Again, somebody might be in this room that's taking methadone to get off heroin. There are people that work in our society, live in our society. I went down not too long ago, and I was walking around because we put some folks in the street to work with the young people hanging out there and trying to get people into treatment. Both people that are homeless and people not homeless. And we walked all around, and it was interesting because every single person out there knew about politics. I was walking a group of young people there, and if you drove by in the car, you'd say, oh, they're addicts over there, they're high, they don't know what's going on. And when I went over, they started talking to me about the governor. They started talking to me about what we're doing, what the legislature's doing, what we're doing in the city. They started talking about what's happening in Washington, D.C. They were as smart as anybody in this room or any room that I'll talk about today. People who are just regular people. So it's important for us to understand that we need to continue to work together with a continuum of care. Recovery is possible. We just need to make sure the resources are there. 20 years ago, next month, April 12th, I got sworn in as a state representative. When I got sworn into the House of Representatives, there was one other guy there, Kevin Fitzgerald. He was there. He was the only guy really that was fighting for recovery services. And 20 years ago, we weren't talking about this like we are today. 20 years ago, I would argue we had an epidemic, but we didn't talk about the epidemic because it was too embarrassing for people to talk about. In 20 years, the legislature has come, and the country has come a long way. Massachusetts has been proactive, innovative, and creative on fighting addiction. Massachusetts last year passed landmark legislation, as you all know. I want to thank the governor for not only passing one piece of legislation, but passing 4 pieces of legislation. I want to thank the legislature for understanding the importance of passing that legislation, because we have come a long way. We have come a long way. The governor talks oftentimes about his own personal story on the street, meeting people during the governor's race. And you can tell by looking at him how he feels about it. He knows his kids have friends. He understands what addiction does. And by coming into the office and making that one of his priorities, I commend the governor for that. The Attorney General, I want to thank her for cracking down on illegal prescriptions. Because again, as Jack Connor said, we have an Attorney General and a governor and a legislature and an entire delegation of people that care about addicts and addiction and being involved in it. And that's important for us as a state. It's important for us as a country. We need to continue to move forward. This isn't about me. This isn't about the governor or the Attorney General or individuals. RIZE Boston's about a bunch of people. Look at the list of people on there. It's not about who the leader is. Everyone on that list is a leader. You go through that list, you have the leaders of SEIU. You have the leaders of hospitals. You have the leaders of industry. There's no leader in that. It's how do we rise everyone up together? And that's what we have to continue to do politically. We filed a bill. I filed a bill at the beginning of this year just to continue to work down to make sure recovery is possible. One component is a 30-day program for covered by health insurance. Because when you're an addict and you're on heroin, 5 days doesn't do anything for you. 10 days doesn't do anything for you. By the time you get to 10 days, you're just starting to get clear. And when you get to 20 days, you're a little more clear. That's why we need the 30-day mandatory to pay for it, to make sure that we keep people in there so when they get out of detox, they have a better, clearer picture. because it doesn't work other than that. Working to make sure people facing first and second drug offenses, that instead of going to jail, we get them treatment. We're putting addicts and alcoholics in jail. If you take the booze and the drugs out of their system, they don't commit the crime. It's that simple. If you ask anybody who gets arrested for doing something foolish that was high or drunk, and you look at their history, they don't have one arrest on their record, not one arrest on their record, that says when they weren't under the influence of drugs or alcohol. So common sense would tell you that if you get the drugs and alcohol in the system, they're not going to repeat and reoffend. We're also going to require chain pharmacies to have drug collection kiosks, so that we explain to senior citizens that when they get a drug and they use them, and if they don't use them on, when they go pick up another prescription, they can bring the old one back and throw it in the box, because people don't know what to do with them. People don't have a clue what to do with them. I'm mayor of the city of Boston. I had kidney stones not so long ago, and I called my cousin, who's a police officer, to say, will you get rid of this for me? You would think I would know where to put drugs. I'm the mayor of Boston. So if you're not the mayor of Boston, you don't have somebody to call, you don't know what to do. Expand the Good Samaritan protections. Those are the things that we're going to push for in this next legislative session. Because what it does, it complements what the governor's already done. It complements what the attorney general's already done. It complements what the legislature's already done. It's a continuation of how do we deal with the crisis that's in front of us. RIZE Massachusetts represents the potential for all of us through cross sectors. Because this conversation is an important conversation now to have. We have leaders like Dr. Meta Jordan of epidemic, who's on the front lines long before the opioid epidemic captured national attention. She's been doing this for a long time. I had a chance when I first got elected to go up to epidemic and walk around. And I should have known, but I didn't realize all the programs up there. On her campus, they have everything you need. You go from a detox to a transition, from a transition to a halfway house, from a halfway house to jobs. It's all in Roxbury, in Boston. And she's doing that. We have companies like, hospitals like Mass General, GE, Boston Medical, and other places, in Brigham, and all the other hospitals, working to make sure that we take the brain power that we have here. Doing a hackathon. Last year, GE did a hackathon challenging local innovators to come up with ways to beat the epidemic. People might say, well, how did that help? We did a hackathon in the city 2 years ago. We had a complicated process for licenses and for permits. And if I showed you the chart, it looked like the NCAA 16 bracket on steroids. And we brought up a whole bunch of people that knew nothing about licensing and permitting, and they had a hackathon. And you know something? They came up with a system that worked. We instituted it. So why not bring in people that might not be as connected? But as somebody said earlier, I think the governor said this, you know somebody's going to walk into that hackathon or walked into that hackathon that has a mother or father, a brother or sister that was addicted to drugs and didn't know what to do. So it is personal for them. We're going to continue working with our great companies for that. This type of leadership that we have right now has never been more important. During the presidential election, I was watching TV one night, and Hillary Clinton was on TV, and she was talking about drug addiction and mental health as a candidate. I thought to myself, it's the first time I ever heard a presidential candidate talk about addiction. A couple nights later, I saw Chris Christie was at a town hall. Chris Christie started talking about addiction. A month later, Jeb Bush started talking about addiction. And you heard every candidate talking about addiction. The president that we have today knows what addiction is because he had it in his family. So I'm hoping that Washington does do the right thing with addiction and support and funding. And good funding, not just throwing money at the situation, but actually working with Massachusetts and other states to see what we need and what they need to move what we have to do forward to end the epidemic that we have. So I'm hoping that our voices are heard in Washington. In the city, we're doubling down on progress that we've already made. We just had a conversation about a citywide prevention study. We had a bunch of people in the office, led by Jen Tracy, who runs our office, and Monica Valdez-Lupe, a public health commission. And we talked about prevention in every neighborhood. There goes the sign. That's my sign. All right, Jack, I'll stop in a minute. We talked about prevention in West Roxbury. We talked about prevention in Roxbury. We talked about prevention in Mattapan and thank you, and everywhere else. A little higher, please. This is what governors do.
Clean up the mess the man.
Clean up the mess the man made. I'll be talking about your budget later. 311. Jack talked about 311. One of the things that parents don't understand. You can keep that. Don't worry about it. I'm done in a second. One of the things that we realize, and the state does this, when parents and people need to get connections to drug addiction, we didn't have a number in the city. What we did, we converted our 311 line into a 24-hour hotline that we can help people have questions on drugs or alcohol, people that might just want to ask a question, it's anonymous, and people that might want to get their loved ones into treatment. The night of my State of the City, when I announced it, I announced it for the second time, I said, anyone who needs help, call right now. We got calls that night. People looking for help. We expanded EMS. We added 20 new first responders out in the street. We're changing the way we deliver our services out to the street. We're creating wraparound services. I say all this because this is an important issue. I'm gonna end where I began. I want to thank RIZE Massachusetts. I want to thank you for your work. And I want everyone, when you leave here today, I know, as I look around this room, I can already tell, there are people in this room that know exactly what I'm talking about with their family members. We need to continue to move forward together. This is not a Democrat-Republican issue. This is not a red-blue city issue, state issue. This is not about a conservative or progressive issue. Drugs and alcohol, drugs don't care. Heroin doesn't care what blood it goes into. Opioid drugs, prescription drugs don't care who you are or what you stand for. And that's why on this issue, it's important for us to continue to move together. It's important for us to make sure that not only do we provide the treatment that people need, but we need to make sure that we start to continue to work on the prevention that people need as well. I want to thank you for the great work. As I look around the room, thank you for all of you for what you do and what you've done for addiction over the last, some of you, 20 years. Learn to Cope is here. Thank you. Thank you very much.
I decided I'd stand over here so the governor wouldn't have to hold the sign for me. So good morning. For those of you who do not know me, my name is Dr. Maisha Minter-Jordan, and I'm the president and CEO of the Epidemic Center. And I'm proud to be a board member of RIZE, and I echo my thanks to all of you for being here this morning for such an important issue. I am a RIZE board member because of the urgency to make more progress on the opioid epidemic. Because RIZE is an independent, not-for-profit, focused on finding and funding the best solutions available for the problem. And because the RIZE board is made up of strong leaders representing diverse organizations across the Commonwealth. The board's commitment is to make sure that RIZE moves forward as an initiative that the entire community owns. There's more information available in the program brochures that each of you received when you entered the room, including a list, as you heard, see, smart thinking on my part, of board members and our bios. And our board members are all here and would be glad to talk with you about RIZE either today or in the future. 4 years ago, Epidemic started a seemingly impossible campaign to raise over $15 million to support the full renovation and expansion of our detox. Based in a historic building in Roxbury, the facility that serves over more than 3,000 men and women each year was in critical need of an upgrade. At that time, as you've heard, addiction was not the hot topic. It was not the cause that resonated with donors, and it was not recognized as being on the forefront of needs impacting diverse communities. Nevertheless, despite the stigma and shame that plagued the disease of addiction at that time, substance use disorder was real, is real, claiming lives, destroying families and communities as it had been for years. And the need for inpatient detox and ongoing recovery services far outpaced the supply of beds and other programs. So you can imagine it was initially very difficult for me to conceive how we were going to achieve our fundraising goal. The shift that needed to happen, that is happening right now, was that we needed to change the conversation about addiction. We needed to change the language, shed the stigma, and shine a light on what so many were suffering with in the dark. Demic's campaign shared the stories of addiction and revealed the many faces of addiction. We enlisted our mayor to share his story, and he became one of the important faces of our campaign. I sat down with donors and with corporate leaders and learned of their own personal stories of how addiction had impacted their families and their friends. I met with our legislative leaders and learned about the increasing volume of calls from their constituents. I met with the leadership from our hospital partners and heard about increases in emergency department visits, hospitalizations, and deaths due to substance use disorders. We also looked at our own data that showed that Demic's Detox was treating individuals not just from Roxbury and other Boston neighborhoods, but from over 200 zip codes throughout the Commonwealth. During that time, addiction became and remains today an issue of the basic human right to live. I'm proud to say that we raised over $16 million to support our Building the Road for Recovery campaign, and we broke ground in January and look forward to the opening of the doors of our Dr. Lucy Sewell Acute Treatment Services next year. Demic's board of over 23 members led by Flash Wiley and Bob Rivers were the first to step up with their support and demonstrate their understanding of the urgency at hand. Beth Israel Deaconess Medical Center, Boston Medical Center, and Partners Healthcare also contributed significantly to our campaign. And let me underscore the importance of what I just said. We are in Boston, home to some of the most prestigious hospitals in the world, hospitals with often competing priorities. However, this disease, this epidemic, is greater than any one entity can manage. And the hospital leadership recognized that and came together for their campaign, for our campaign, as they do today in support of a common cause. Our primary philanthropic partner, the Yawkey Foundation, is a major supporter throughout the process, helped us to bring other philanthropic organizations to the table by allowing us to leverage their support and reputation in the philanthropic community. Our corporate partners, donors, and legislative leaders all worked in concert to uplift our cause and support the capital and programmatic needs of our detox, and I'm deeply grateful for their swift and generous contributions. But I say all this because the key to our success came from a meeting like this one today, a meeting that represents the collective power of all that have been impacted by this disease, all too often a deadly disease. It comes from the recognition that each of us in this room are critical stakeholders necessary to turn the tide of addiction. We must approach this as a basic right to live, a moral cause, a community cause, and a business imperative. After all, we know that there is no immunity from this disease. It impacts us all, as we've heard this morning, regardless of our income, our race, our ethnic background, or where we live. Therefore, each of us in this room has a personal responsibility to take on this issue as if we are fighting for our own lives and for those of our children. The success of Demic's campaign is a testament to the energy that is in this room today. Each of us represents a critical component to the solutions that we need to affect change in this epidemic. We need our corporate community, philanthropic community, academia, legislative leaders, health system leaders, and community members to work together, to rise up together, to support the prevention, treatment, and recovery for substance use disorders. That is why we are here today, and that is what we can do collectively. It is our time to rise. Thank you.
Thank you, Dr. Minter-Jordan. It occurs to me that what today is all about is example. Thank you, Dr. Minter-Jordan. Thank you very much, Doctor. And it's about leadership. The governor spoke about the negative momentum that he witnessed over the past several years. Today is the beginning of taking advantage of leadership's example, the electeds, if you will, and the medical example. And now we have the opportunity to step up. Maybe we should have done it sooner, but we're doing it today. We've committed to raise $50 million. We've already raised $12.8 million. They have $50 million. And there's some very positive momentum behind us. I promise you, that as we build this program, we will spend even less money on signage and mucilage and more on programmatic activities. We have 3 speakers who are going to come up now and just address why they contributed, and they have contributed significantly to this. We have one from the SEIU. Tyrek, I'd like to invite you to come up. We have another from General Electric. You know, General Electric's done so much good all over the world, really, but now, thanks to the leadership of the governor and the mayor and the sense of humor on the part of the GE executives, Boston is now home. Thank you very much. And so we're going to hear from Deirdre, and we're also going to hear from an old friend, Andrew Dreyfus from Blue Cross Blue Shield. So Tyrek, I'd like to ask you to come up, and then Deirdre, if you would follow. Thank you very much.
Thank you, Jack. Hello, everyone. My name is Tyreek Lee Sr. I am the Executive Vice President for 1199 SEIU, the largest healthcare union in the state with 56,000 workers. You know, personally for me, I've dealt with my mom in addiction and recovery and prevention for nearly 30 years now. Yes, I know I look good for my age. But it's been very difficult, you know, going through this path of being her recovery coach, looking for services in the community has been difficult. You know, when I was able to finally find somewhere for her to go, it was over 2 hours away. So it becomes even more difficult to make sure that I'm there for her. But also as the Executive Vice President of Massachusetts, we have 56,000 members in the state, and they are frontline healthcare workers who see this every day, from the registered nurse to the housekeeper to the dietary worker. And even our own Lisa Murphy, who's here today, and I thank you for driving up from the Cape Cod, and you know, along with Michael, has seen this every day just at Cape Cod, but also has lost her sister a couple years ago to addiction. Also has helped her daughter in recovery. So not only are we working this every day, we're living it, just as Marty has said, just as, and I hope I can call you Marty and Charlie, I will anyway. But just as they have said, there's not anybody in this room or anybody that we know that has not seen or lived this. So it's important that I want to thank our elected officials, I want to thank all of you for being here, and I know it might be challenging to say zero stigma or 0 deaths, but when you rise to the challenge of leadership, and your belief is strong and your purpose is just, no obstacle will stand in your way. I'd like to introduce Deirdre Latour. Thank you.
I'll go for the no signage. I'm going rogue here. So good morning, and I'm Deirdre Latour. I'm the Chief Communications Officer at GE and on the board of the GE Foundation. I'm so happy to be here. It's so important to us at GE. Thank you to the governor and to the mayor and the attorney general, and thank you very much, Jack. This is a really important issue to GE, and if you know GE at all, we are relentless, right, Governor? Mayor, we're relentless. We are in a relentless culture. So this is important to us. I'll just spend a few minutes in talking a little bit very quickly about what we're doing. And my hope is that this is a call to action for other companies in the Commonwealth to contribute funds and resources and ideas, and that's sort of why we're standing here today. So as some of you know, when GE announced that we were moving to Massachusetts, to Boston, we announced a $50 million commitment to, philanthropic commitment to the city and to the Commonwealth, and what we've done is taken 15 million of that 50 and assigned it to target healthcare issues, and in particular issues around helping to cure help solve the opioid crisis. So after meeting with many of you and local stakeholders in this room, we decided to focus those opioid efforts on both innovation and capacity building. And just as we're coming together today as a public-private partnership, we're working with several partners in the room to implement our programs. We started in September. The hackathon has been mentioned a couple times with CamTech and Mass General Hospital to work on an opioid hackathon. We had more than 250 people there. It was really phenomenal. Lots of great ideas that have come out of it. Some of them were GE's mentoring teams of people that came out with great ideas from the hackathon, and several of the ideas we're starting to fund and are showing results and promise. We're working with Partners Healthcare on focusing improving behavioral health and addiction medicine at community health centers, so those centers can treat more patients more effectively. With Boston Medical Center, we're working in community health centers to train providers in providing care for substance disorders, including medications and addiction. We're working with Mass General on a medical fellowship, and with the Massachusetts League of Community Health and the Kraft Center, I'm bringing more women and diversity to the next generation of primary care providers. So lots of great work that we're trying really hard from the GE perspective to bring to the community. And just one last word on erasing the stigma. It's come up a lot of times, but it's something we're talking a lot about at the GE Foundation, and how important it is to work together to bring the right context and support and sort of normalize addiction so that the stigma can be erased more easily. So we can do great things together by seeding ideas. We need more of you. We need more of the private sector to join RIZE and to join the fight. So I want to thank you very much, and thank you for your time.
Good morning. I'm Andrew Dreyfus from Blue Cross Blue Shield of Massachusetts. I'm the last speaker, and I'm hoping I'll be the briefest. But I want to make 3 points for you this morning. First, like Tyreek, I too am a family member, and I've known and I know today the fear and frustration and also hope that comes with both addiction and recovery, and I feel it every day, and I feel it personally. Second, Blue Cross Blue Shield, 5 years ago, before the opioid epidemic was making headlines, launched a first-in-the-nation program to reduce the number of inappropriate opioid and other prescription pain prescriptions that were going into the community. That program has reduced by 21.5 million doses the number of prescription opioids that are going into the Massachusetts community. That program became, in part, a model for some of the work that the governor and the legislature signed into law. It's been reviewed by the Centers for Disease Control as a unique program of a private initiative advancing a public health goal, and has now been replicated across the country. The third thing I want to say is I am proud to be a founding member of RIZE, and at Blue Cross we're pledging 2 things. One, financial support, but perhaps more importantly, a place to test and measure the effectiveness of the treatment models that RIZE develops. So if recovery coaches is part of the solution, let's understand it, let's test it, let's measure it, and then let's support it. And Blue Cross, as the leading plan in the state, is prepared to do that. So we thank you for all your support this morning. We're excited about RIZE, and we're committed to its success. Thank you very much.
So thank you all very much for being here. Dr. Wakeman, thank you for your amazing example for a long time. We've heard from all the leaders. We've heard from the governor. We've heard from the attorney general. We've heard from the mayor. Now we need to hear from you. I really appreciate your willingness, based on your presentation, to agree to be the person in charge of raising the extra money to get us to $50 million. That was a great opening pitch for the 50. So thank you all very much. We're going to have board members are going to stick around. If any of you have any questions, we accept cash, but we prefer checks. Have a wonderful day, and thanks for being a part of this beginning.